We tried to have children and it wasn't working.
What we had been setting ourselves up for was now at risk.
Trying to have conversations with OBGYNs, I got brushed off frequently. When we discovered endometriosis, the doctor explained this is contributing to my infertility.
The delay in diagnosis of endometriosis is well documented.
We had to do what we could as a couple. We found out we were pregnant. It felt like an amazing triumph.
I have my dream that I've always wanted ever since I was a child. I have, ever since I've been little, wanted to be a mom. My mom brought me a bunch of kids stuff. You read through my papers and it's like, I want to be a mom. So internally, I have always loved children and working with children. When Brian and I got married, we tried to have children and it wasn't working, and we didn't know why.
We were just always waiting on, okay, when's time good for us and when can we be the best parents possible? And now we had this thing where all that is in jeopardy. That what we thought was secure and we had been setting ourselves up for in life was now at risk. There was nothing we could do about it.
So we just kept going through life. My name is Sara, and I have endometriosis.
The symptoms of endometriosis can be extremely debilitating for many patients that have it. Pain can often start at very young ages. Unfortunately, we know that on average throughout the world, the average time from when someone begins to develop symptoms to when they get the proper diagnosis can be anywhere between 7 and 12 years.
My period came on heavy and strong, extremely painful. For me, symptoms of endometriosis included diarrhea, vomiting, nausea, extremely heavy period, lots of bleeding. And that was essentially what I experienced from the beginning of my periods. And it continued to get worse over the years for me. And I didn't know what it was, despite me trying to have conversations with OBGYNs or doctors as to what was wrong with me, but I got brushed off frequently. Just saying, oh, you have a heavy period, or yeah, that's periods.
There is a huge problem with dismissal of pain in women, as well as a lot of misconception and bias and stigma related to menstrual issues.
I was miserable. I often couldn't participate in activities that other friends or peers could participate in because around that time of the month, I didn't know how heavy my blood would come out.
Endometriosis is also a very estrogen-driven condition. So any condition that's associated with a longer lifetime exposure to estrogen has been associated with a higher risk of endometriosis. So those include having your period at a younger age, going into menopause in older age.
You'd see the comfortable Sara come out and she's wanting to go out, but until when something wasn't right, she always was more hesitant to go anywhere or do anything because of just how she was feeling and the hesitations towards that.
And then around 31 years old, I was basically, I was in really bad shape one day. I started throwing up and I had tons of diarrhea, and I was going in and out of consciousness, and it was worse than I had ever experienced. That's what ultimately brought me to my OBGYN, who listened to my symptoms, my story, and she looked directly at me and said, "I think you have endometriosis."
It was good to have a name to it, right? With a name to it and identified, it made it so it was real and approachable. It wasn't no longer something that was just in her head.
So the delay in diagnosis of endometriosis is definitely well documented both in the United States and throughout the world. Unfortunately, as clinicians, we're not well trained in the evaluation and management of pain conditions. The other issue is that we don't have a non-invasive way to diagnose it.
My OBGYN ordered surgery to confirm that it was endometriosis, and she discovered stage 4 endometriosis.
In patients with endometriosis, there seems to be an exaggerated inflammatory response where that tissue doesn't get cleared up naturally by the body, but actually then implants into other organs and then grows in new blood vessels as well as nerves. The main goal of surgery is to remove the implants that we can identify, and the medication treatment options are primarily related to lowering those estrogen levels, which tend to stimulate the endometriosis.
When we discovered that I had endometriosis, the doctor explained that this is probably contributing to my infertility. So she had said that hopefully this surgery will help with the infertility in addition to the bleeding and the pain and the nausea. It did not help with the infertility, however. And so when we moved to San Diego, I actually transitioned to being a full-time nanny, and I loved it because I got to work with children. Eventually it became too painful through our fertility journey to work. It started hurting my heart too much because we couldn't have our own.
So once we found out, like, all of the medical techniques and everything wasn't working, we had to put our trust and faith somewhere else and just do what we could as a couple.
So I was like, but something feels a little strange. I wonder if I should take a pregnancy test, but I was also extremely hesitant because I had taken so many in the past and they were a little disheartening to me. And I prayed, and I was bargaining a little bit with God, but I basically was like, God, I don't want to take this pregnancy test. It's gonna be negative, but something's telling me to take this pregnancy test.
Do that? When we found out we were pregnant, it felt like an amazing triumph. Like, we finally got to that mountain peak and we climbed up there, and it was so rewarding.
And now she's our miracle baby. She's here. Hey, it's me, Papa. Shiloh made her debut, and she's strong. She has a very strong personality, and I always joke that she had to be to survive my womb. She had that strong personality in the womb, I'm sure of it. What are
There's a lot of active research in the field of endometriosis trying to identify new treatment strategies for this condition.
So currently, to kind of keep my endometriosis under control, I have an IUD placed in my womb and I take 5 milligrams of progesterone treatment. And then on my own, I kind of keep a gluten-free, dairy-free, red meat-free diet to try to keep any inflammation that might happen in my body down to a lower level. I feel really good today.
I think especially for women, whether it's endometriosis or even prior to endometriosis, is to advocate for yourself because it's hard out there, right?
That looks lovely.
If a doctor does dismiss you, go to another one. Just keep pursuing it and don't give up, because it took me 20-some years, over 20-some years before I got a diagnosis, I got some help, and I am so thankful that I did.
Okay, 1, 2, 3. Woo! Okay.
I don't have to worry anymore about going out and all of a sudden being like, I'm in so much pain, I need to lie down. The pain is pretty much non-existent, and I am way hopeful for the future. And I have Shiloh. I have my dream that I've always wanted ever since I was a child. And I can't wait to watch her grow up.